Hello, how you doing?
Good, how are you?
Doing good. Once again, I'm Laurice. I'm your case manager.
That's right, hi, I'm
All right.
Brent.
Okay, Brent, you doing okay?
Doing okay, thank you.
All right, this is a follow-up from our last meeting.
Mm-hmm.
And I believe last time you voiced some concern in regards to a few issues, and we're going to go over that.
Okay.
But before we start, I want to let you know everything we talk about here is still confidential. The only thing would have to be released is any information of you harming yourself or someone else is in danger. So everything else is confidential, and we have a few things we would like to go over today, if that's okay with you.
Mm-hmm.
Okay. All right. The last time we met, I believe you had stated that you had some things that kind of you don't have to get treatment for, but I remember a response in regards to alcohol.
Mm-hmm.
You said you have a large amount of alcohol intake, or you drink quite often. Is that
I've been
true?
trying to cut back since we met.
Okay. All right. Well, I have a questionnaire I'd like to go through with you. There's a few assessment questions in regards to alcohol, and it's just to see if there's any reason that we need to get any kind of attention or some kind of treatment for that, if it's okay with you.
But you're not telling me I can't drink.
Well, we're just going to see. I mean, I'm not telling you that you can't drink, but I'm just saying drinking may have an issue with some of the things that's going on.
Okay.
And if there's an issue going on there, we may have to look into that. And is that okay with you?
That's
if we do
fine.
that? Okay.
I'm not going
Okay.
to tell my wife, though.
No, this is between me and you, and this
Okay.
the veteran.
That's right, I heard you.
Yes, okay.
That's right.
Did you have a hard time parking here today at the
No.
VA? Okay, good. All right, we'll start off. I'll be giving you a few questions, and I'll tell you how to answer them, and then you can answer them after I'm done. I'll read the question first.
Okay.
The first question is, how often do you drink or have a drink containing alcohol?
Every day?
Okay, the answers would be never, monthly or less, 2 to 4 times a month, or 2 to 3 times a week. Which one sounds, what would you want to say, daily?
I'm going to say daily.
How many times a day?
Well, I probably have 2, 4, 6, maybe, I don't know, anywhere between 2 and 8 drinks a day.
Okay. Okay, and some of these questions that we're going to ask may overlap with that, so we'll just
Okay.
take that as it comes. How many drinks containing alcohol do you have on a typical day when you are drinking, which I think you said it was between 2 and 8. So the answers here were 1 and 2, 3 and 4, 5 and 6, 7 and 9, 10 or more. Is that still correct?
Yeah, I mean, if I'm drinking beer, I'm drinking a lot, maybe 10.
So we'll say 10 or more a day?
But I'm trying to just drink liquor,
Okay.
so I have less, probably only like 4.
So you have liquor and a beverage with beer?
Sometimes.
Okay. So 3 to 4 liquor, and then maybe how many on
Maybe
beer?
6 to 15 beers. That sounds like a lot.
Okay. Third, how often do you have 6 or more drinks on one occasion? Never, less than monthly, weekly, daily, or almost daily?
Almost daily.
How often during the last year have you found it difficult to get the thought of alcohol out of your mind? The answers will be never, less than monthly, weekly, or daily, or daily.
Well, since we last met, I feel like I've been thinking about having to answer that question, and so I've been trying not to drink, and it makes me think about drinking more. So maybe like every day.
So daily. How often during the last year have you found that you were not able to stop drinking once you had started drinking? And that would be the same. Would it be never, less than monthly, weekly, daily?
That's an interesting question. Once you start, don't you just drink till you pass out?
Well, how do you feel about when you start drinking? Do you, I mean, has that
I
in the
don't
last
stop
year?
till I fall asleep.
Okay.
So I don't think
So
about stopping.
have you ever started, so you don't, after you start drinking, you don't think about stopping?
Not usually.
Okay.
I mean, I don't have much of a life right now, so I can just stay home and drink all day.
Okay. And
And these pills make me fall asleep.
Okay. How often during the last year have you been unable to remember what happened the night before because you had been drinking? You want me to repeat the question?
No, thank you. I don't remember most of any night.
Okay, so most nights you don't remember.
Mm-mm.
Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session the night before?
Well, I try really hard not to drink in the morning, but when these pills, I got to do something because they just make me fall asleep. So I've been drinking in the morning a couple days a week.
Okay.
This doesn't sound too good, Laurice.
So, we're going to go through this and then we'll go over everything when we're done, okay?
Okay.
All right. How often during the last year have you had a feeling of guilt or remorse after drinking? And that would be never, less than monthly, weekly, or daily.
Well, I would say that I don't wake up feeling remorseful until my wife starts yelling at me about the night before. So that's every week. Not necessarily every day, but every week she's barking at me about something I did the night before.
Okay. And have you or someone else been injured as a result of your drinking? Yes or no?
Yes.
And has a relative, friend, doctor, or anyone, such as a health worker, been concerned about your drinking?
No.
No? Okay. All right, that completes our assessment.
Well, I guess you.
Yeah. Okay. All righty, that completes our assessment part of it. We have a couple programs. Of course, I'm going to have to get with my supervisor and go over this information with them. But we do have possible programs that we have. Have you ever heard of the DOM here at the VA?
Mm-mm.
Okay, the DOM is where you can come in. It's almost like where you can get refreshed, get off of alcohol or drugs, and they actually help you with your medication. They have a treatment process, and you can actually stay here. Then we have the other.
How much does that cost?
It's free.
Free?
Free for
Sign me
veterans.
up.
Yes, it's free. We just have to get a referral from your primary care provider.
Wait, but then that
And
means I'm not drinking.
You wouldn't be drinking. Yes, correct. Yes, that's.
Is that like a detox?
It's not really like a detox, but yes, it's zero tolerance for alcohol or drugs. So, and then we have a group session that we have, and then there's a AA session that we have. And I just want to know before I go talk to my supervisor, are you willing to participate in one of those if it's going to help your overall health and well-being?
I'm not going to no AA. I've
So-
heard about that. But
Okay.
I mean, group, like we're talking about myself?
Well, you go there and you talk about things that are possibly making you drink alcohol, things as far as the alcohol intake and such as that, and try to find options to, help you with your issues that you have right now. That's one possibility. Or the DOM, do you feel like, I know you're saying you have a lot of issues at home. Do you think that going to the DOM for a couple weeks would help? Possibly to get your head cleared and help you out? It's just possibilities that we have.
I mean, I don't know why I'd be interested in that, because I'm really not interested in quitting drinking. But it does sound nice to just get away for a little bit. But I'll tell you, Laurice, I've tried to stop drinking on my own once before, and I got sick as a dog.
Okay.
And so I can't just not drink.
Okay, that's why we have programs here to try to help you. I just need to know if you mind signing a release form and give us permission to be able to go forward as far as trying to help you drink, because it's not going to help anything if you're voluntarily not wanting to help yourself. So we've got to have that, taken care of first. And if you do want help, if you do want to look at other options, then we can go forward with that. And I have a release form. If you don't mind, I'll go talk to my supervisor, and we'll come back. We'll make another follow-up appointment, and we'll go from there, if that's okay. Does it sound good, or do you have any concerns with that?
Well, I have concerns, but I think I have more questions maybe if I had a little more time to think about it. But, what I'm thinking right now is that maybe if you had some paperwork I could take home with me and look it over, I'd be interested in
And we
it.
do, yes, we do have that, and then I have a sheet that you can jot down all your questions
Okay.
on there, and you can fill out, there's a little, sample, it has questions in there, and it has any kind of issues, anything, any programs, or any kind of resources that you think you need, you can fill that out too. I'll give that to you too before you leave.
And you'd tell my wife I'm somewhere legit?
Oh, well, we would leave that up to you, how you want to do it, but if you wanted us to come in and contact your wife with you, we'll do that too.
Okay.
We just gotta have your
But she's
permission.
not gonna believe me.
Okay, well, we'll just get you to sign this release form right here, and I'll
Okay.
sign it first. This basically just giving the VA permission to assist you and give you help. If you mind signing right there, and I'll go talk to my supervisor, and we'll make another follow-up.
But you're not gonna lock me up if I sign this?
No, you're not getting locked up at any time. It's all voluntary,
Okay. All right.
okay?
Thanks,
All
Laurice.
righty, you're welcome. We'll be back in touch, okay?
Sounds good.
All right.
Bye.